Well, hey, Kevin.
How's it going, Rob?
It's going well. Thank you for doing this today. This is a quick follow up to the sample that we sent out to Kevin's dog, Woody. And so we're going to hear a little bit about, after it's been a few weeks on, I think several weeks on Gussy's gut,
About a
some of the
month, yeah.
changes, right? 2 months?
Yeah, somewhere in there.
Yeah. Um, we're going to hear about a little bit about Woody and some of the things he's working with, and then also how Gussy's gut has affected his life. So let's start with a little bit about Woody. Let's age and some of the challenges he's dealing with. So we have have a quick little up to speed.
Sure thing. We've got quite the history with him. So he's a 13-year-old soft-coated Wheaten Terrier. Has had a history of periodic intestinal issues, most notably diarrhea. In August of 2021, we found out that he had tumors on his adrenals. He had to have surgery in September of 2021 to remove the tumors. They also had to remove his adrenals. So he cannot produce cortisone, which regulates the production of glucose, his metabolism, the breakdown of fat and proteins. I mean, it's a core element of his health. With those being removed, he's now on daily prednisone tablets and a once monthly shot of Percotrin, which regulates his sodium and potassium levels. Again, prior to this, he had a history of intestinal issues. One of the hallmarks of Addisons, which is what happens when you don't have adrenals or they don't work, is a lot of diarrhea. So we've had issues with the 3 a.m. He wakes up freaking out, having had an accident, Jackson Pollock painting level issues, and he's stressed, we're stressed. And a friend actually contacted us who you'd worked with, Rob, and said, funny note, we were on a Zoom call. He had an accident next to my feet. I'm like, I have to get off. She texted me and said, hey, you should try this. Got him on it, and it's been like his system has been rebooted. He's healthy, normal sort of intestinal production, much happier dog, I would say, overall, and health levels overall are much better.
Right. I think first time we spoke was about this was you mentioned that you were following him all around with the wet dry vac, and it was all the time, right?
It was pretty continuous. It was at least once or twice a week we would have an issue. And again, you're wanting your dog to be healthy. As a dog who, very obedient, very loving, he was very upset when he would have these accidents. It wasn't just an oops. It was a hour of him being stressed out and worried and, putting his head on our laps and like, I'm so sorry. So that's gone. I mean, we have not really had an issue. There was it took a while for everything to hit his system. But now he's fine. We have not had an issue since then.
Well, that's great. So you went through the history. He has like current diagnoses with Addison's disease and anything else?
So no, he has some arthritis at 13 years old, at 59 years old, I have some arthritis, but sure. So walking him, he also herniated a disc 2 years ago, which has caused some paralysis in his back legs. But overall, since we've been on the Gussy's gut, and I will point out, Woody is a fussy dog. He turns his nose up to everything. And in fact, I think, Rob, you said, well, try it and see what he does. And he readily jumped in and ate it when it was mixed into his food. In addition to the intestinal issues, I would say joint-wise, he seems to be doing better. Just overall, his health is much, much better than it was before. A lot more alert. He's just seems to be happier overall. Disposition is much better.
Good. Well, we're going to show him in a second on camera, but he's off camera, so we'll move the camera over before we end the video, and we'll say hi to him. I mean, you know, you looking at him, you never know. I mean, the dog is. I mean, he's beautiful, and it looks like in great shape for, you know, lose your adrenal glands. I mean, you know, you'd expect a dog that you know, and he's 13. I mean, he looks phenomenal. So it's a testament to you guys.
Well, I would say it's a testament to what you're producing here, because yeah, we've gone through all the medical stuff, but there's only so much that, you know, surgery and things like that can do. And the probiotics that he's on have vastly improved his quality of life. I mean, there's no doubt about that.
Do you mean external probiotics or Gussy's gut?
Gussy's gut.
Oh,
Yeah.
okay.
He's not on anything else other than
okay.
that, and then the medicines that I've talked about.
Yep. Great. Sometimes what we hear, and we see this in NIH articles for humans, that when they eat fermented foods with their medications seem to work better. And these are obviously in some cases, not every case. Do you see this at all? Is there anything to indicate that any of his medications are you know, changing, working differently or better or anything?
Well, so we've been on a journey with Addisons to reduce the cortisone levels and things that he's on, and that's a constant adjustment titration. We've gotten him to low levels, and they're working very, very well.
Good.
The balance with the cortisone is to make him, prednisone is to make him healthy, but not hyper all the time and constantly having to pee, things like that. And we've got him at a great spot right now.
Good.
So yeah, I would say things are working pretty good. Our vet was hesitant to lower the doses. We'd read a lot about it, and in conjunction with the Gussy's gut, it's working very well.
All right, good to hear. And so this has been maybe about 2 months. Woody-ish has been on it, and that's great to hear. So his quality of life seems to be improving. His mobility seems to be improving. GI issues.
1,000% better. I mean, ridiculously better.
Great. Well, let's have a look at Woody before we get off the video, if we can, see if he's around.
Okay, this will be awkward because he's on the other side of the table.
Okay.
He has to be close, but not too close when cameras are on.
Oh, okay, great. He's camera shy.
He's camera shy. He really is. Woody, hey buddy.
There he is. All right.
Who's talking to you?
Hey, Woody. Look at that boy. All right. What a handsome dog.
Very happy puppy now.
What a handsome dog. Well, it's amazing. You could see, I always look at the eyes.
Yeah.
You could tell a lot.
His eyes are bright, they're clear, focused, whereas before he sort of had that pained look in his face, and now he's a happy boy. He's very curious as to why I'm kneeling here, and
oh yeah.
Normally he's not on videos like this.
And with his back issue, the fact that he's standing and he's you could see he's trying to get his bearings, but he's on sure footing, which is really good.
Absolutely. Yeah.
Yep. Well, Kevin, thanks for your time.
Thank you. Thank you for what you've done for Woody, because special boy, and it's been amazing what it's done for him.
Good. And I'll forward this. I'll make sure this video gets seen by Dr. Billinghurst. He'll love that.
Yep.
All right. Have a great day.
Thanks, you too.
Thanks, Kevin.
Bye now.
Bye, Woody.
Bye, Woody.